Welcome to HFBS training. This is an overview session introducing HFBS. What is HFBS? Health Facility Briefing System is a web-based toolkit for briefing and specifying health projects. HFBS is a service, not software. Users can log into the HFBS website using a standard web browser, access comprehensive standards for health design, and obtain ready-made standard components, including briefs and room layouts. Users can assemble detailed briefs, specifications and schedules on the web without any software within a secure environment. HFBS contains many modules that cover every stage of a project. It is the essential toolkit for health planners, designers and health officials from the earliest project stages through to final completion and operation. The HFBS solution provides rapid procurement of health facilities, live access to guidelines worldwide, ready-to-use standard components, analytical tools and benchmarking standards, domain-specific customisation. HFBS has several domains that offer localised health facility guideline data and other functionality specific to the healthcare systems of a geographical region. Here is an example of current domains. Each domain has its own logo. HFBS contains a series of tools and apps to help simplify the complex process of health service planning and health facility planning. To understand the relationship between HFBS, health planning and guidelines, we will briefly review the principles of health planning. The following diagrams will detail how these processes work and complement each other to assist with understanding health planning and the processes that HFBS helps to simplify and automate. The health planning discipline covers two streams, health service planning and health facility planning. On the service planning side, we have demand and supply, which allows us to analyse the gap in services. We can automatically calculate demand based on population profiles using our service planning tool. Supply is captured by surveying facilities in the region. Demand minus supply equals the gap. The gap is what we need to provide as health facilities. The HFBS Health Service Planning System is a series of web-based modules used in conjunction to capture and analyse the need for health services in a geographic region. The software captures detailed surveyed information of an existing healthcare system from owners and operators, analyses trends in health service demand and supply now and into the future. Then it can simulate a plan for the future of a healthcare system. Health facility planning relies on guidelines to develop the brief that flows into a design, approval and procurement of health facilities. Health facility guidelines include the acceptable standards for health facility planning and design in a geographical region. HFBS provides access to the latest guidelines in a simple, ready-to-use format, both via the HFBS tool and on the International Health Facility Guidelines (IHFG) website. We will now overview the basic principles embedded in guidelines. The typical hospital consists of departments called FPUs or functional planning units. Departments are connected by circulation corridors. Functional planning units generally consist of rooms connected by internal corridors. The rooms are mostly typical, called standard components, and repeatable throughout the facility. HFBS has more than 450 standard components that are aligned with guidelines. Here is an example of typical bedrooms connected by a corridor with en-suites attached. Guidelines include a written description of each FPU, planning and design information covering OH&S, infection control, engineering aspects and standard components. Standard components comply with the guidelines, particularly for issues concerning the corridor width, circulation around beds, ergonomics, access, mobility, and OH&S. IHFG standard components are available in the following formats: PDF room data sheets, PDF room layout sheets, AutoCAD drawings, Rivet drawings. HFBS is based on the latest health facility guidelines such as the International Health Facility Guidelines, IHFGs. Standard components are provided as room data sheets and room layout sheets. The room data sheets are a written description of the room and its requirements. The room layout sheets are the room plans at 1:50 scale showing 2 and 3D views with equipment locations, the room size, and room elevations showing heights. Now let us look at some of the modules contained in the HFBS suite of tools, starting with briefing. Using the guidelines and analysis gathered in earlier stages of health planning, a brief for a healthcare facility can be rapidly created. HFBS contains a quick briefing module called QSOA, Quick Schedule of Accommodation, and a professional module called HFBS Briefing that contains many additional functions. Both can rapidly produce a brief for a health facility. Load a project and copy standard components, departments and rooms straight from HFGs. These automatically comply with guidelines. This module uses drag and drop technology. The room details at the bottom of the screen can then be edited, including room fabric, furniture and fittings, fixtures and equipment, and services. HFBS produces reports based on a series of reporting templates. The reports are generated by the HFBS server and returned to you in PDF, Excel or Word format, depending on the report template chosen. You can choose from over 45 different report templates. Obtain richly formatted PDF reports such as room data sheets, equipment schedules, schedules of accommodation, schedules of finishes, cost reports, asset reports, and many of these are available in Excel format. The Products tool can be used to select and specify fabrics, furniture and equipment. This includes details of the colour and the finish. We can input fabric, furniture and equipment products, insert product codes directly into the room data sheets, create automatic schedules of finishes, create project-specific legends and print complete with samples. Here is a project-specific finishes legend. The purchasing module provides for scheduling of furniture, fittings, fixtures and equipment called FF and FE by item. It identifies a domain budget and users can add their own project budget and actual costs. Procurement details, orders and invoices can be added to each item. Highlighting an item will identify locations, quantities and selection for FF and FE throughout the facility. Another tool in HFBS is for calculation of project costs. The HFBS costing module allows us to obtain an automatic construction budget. Once the project is briefed on HFBS, the module can extract the list of departments or FPUs from the project. Each department has a domain budget cost rate applied in dollars per square metre, or the project can apply their own cost rates in dollars per square metre. The gross area is extracted for each department. A percentage level of refurbishment can then be set for each department, and if not set, it is assumed 100% new work for those departments. This will provide an automated calculation of fit-out costs based on HFBS briefing data and FPU cost rates. Other tools include calculators. The car parking calculator displays the number of car parking spaces required based on staff numbers, hospital beds, and the location in a metropolitan or country area. Simply answer each of the 9 categories and the number of car parking spaces is recorded instantly at the bottom of the screen. The program calculator is based on cost and acceleration level. Enter an estimated contract amount and select the level of acceleration from slow to expedited. The system will show the number of weeks required for design and construction. Instant messaging is a team collaboration tool. This allows easy and instant communication between project members. Users can chat, have web meetings, and then email a web meeting transcript. This tool is incorporated into Document Manager, a web-based document storage and management system. The Document Management module is a sophisticated file storage and transfer system. Files stored in this system can be linked to your original project brief. The system contains version management and check-in, check-out functionality and can create formatted file transfer emails for communication with internal and external team members. Each project has a folder structure. Files can be loaded into each folder, which may include plans, existing and proposed, reports such as schedules, manuals, legal documents, pictures, before and after pictures, and progress photos. These may be displayed as thumbnails or lists. Let us now review tools designed to assist after procurement to commission, manage and maintain facilities. Firstly, the Recurrent Costing module. The Recurrent Costing module has two aspects: human resources, HR, and goods and services, G&S. The system determines the HR requirements using a bottom-up method, listing the exact job titles and FTEs per department and in aggregate. These are then automatically costed and escalated based on unit rates. The G&S utilises other benchmarks based on area, bed numbers and other parametric calculations. The combined cost is the recurrent cost. Once escalated, it becomes the life cycle cost. HFBS also includes an asset management tool. Once a project is completed, it is regarded as a property asset. All information collected through various modules of the HFBS, especially the briefing and purchasing modules, become available through the integrated user interface of the property module. This module can be accessed on a PC or tablet using just a browser with a mouse or finger. The information hierarchy includes campus, site, building, department and room. Within each area, the same information fields are available as in the briefing module, plus service systems, external fabric and finishes, leasing information and property map. The HFBS Defects module can manage the project defects on site, generate reports and track the history. Generate and look up defects under date, location, category or QR code. Key features are severity from low to critical, status, open, pending, fixed or rejected, sort by date, location and status, take pictures and videos, annotate pictures by finger, notifications and costs, repeat inspections, switch to QSOA for iPad and then back to see the actual project requirements. Locations are preloaded from the HFBS. The HFBS for Rivet module bridges the gap between project brief and model design and saves hundreds of hours needed to audit and verify models during the design process. Bring the functions of HFBS right into the Rivet add-in ribbon. Then easily synchronise and audit your Rivet models with HFBS using the HFBS for Rivet add-in. The required building contents, families, can be dragged and dropped from HFBS briefing list directly into the model, creating data links. It is also possible to link to existing families. The system will auto-generate designed room and department areas. Health facility construction projects happen on-site as much as in the office. The HFBS platform is adapted for use on a variety of mobile and tablet devices. These highly functional modules, designed for professional healthcare planners, designers and facility managers, help you stay connected to your project whilst on the go. This has been an overview of HFBS features. HFBS has tools that cover the entire spectrum for rapid procurement. This includes service planning, project briefing, project delivery, asset management, and that process provides benchmarks to inform policy and guidelines. HFBS is constantly evolving and adding new modules. These modules will be covered in more detail in separate training sessions.